Hi, good evening, everyone. My name is Meredith Rosenbeck, and I am the CEO of the Honor Flight Network. I would like to welcome everyone to this evening's webinar hosted by the Honor Flight Network, featuring Dr. Kim with the U.S. Department of Veterans Affairs. As you may know, Honor Flight trips have been suspended since March of 2020 due to the COVID-19 pandemic. We are hopeful that we can resume Honor Flight trips by mid-August of 2021, but we continue to be mindful of the ever-changing circumstances surrounding the pandemic. And as always, safety remains a top priority of the Honor Flight Network. To that end, if Honor Flight is able to resume travel in 2021, the National Honor Flight Board of Directors has announced that those who are able to and choose to be vaccinated for COVID will be able to participate in 2021. Those who are unable or choose not to be vaccinated will not lose their place in line on the waiting list, but will be placed at the top of the list when we are out of the pandemic. This evening, Dr. Kim will be sharing a host of information with you on the COVID vaccines, the VA's vaccination program, and other important information. After Dr. Kim's presentation, we will have time for her to answer a few questions for us. Please feel free to type in questions during the presentation using the Q&A feature, not the chat feature, please. And Dr. Kim will answer as many questions as we can get to at the end of her presentation. Thank you. Dr. Kim?
Thank you, Meredith, and thank you everyone for having me and for joining on either evening or early evening time to hear about the COVID vaccine. Today, I'd like to tell you about the COVID vaccines that are available, give you some information on how well they work and their safety. And I think at this point, I'm proudly speaking to an audience who either has already gotten the vaccine and wants to know more, or is not sure, or has decided they want to get more information before getting vaccinated. So I would love to share with you the information we have about these vaccines and how they can keep you and your family safe. I will say that I, in addition to doing this COVID vaccine work for VA, am a primary care provider at the Durham VA Medical Center, and I do take care of patients. And it is an honor to be on this call and to share with you information. I consider all of you, like I do my patients, as people that I really want to help make a decision and put the information in your hands to make a decision about whether you or your family would like to be vaccinated. So if we could go to the next slide. So this slide has a lot of numbers, but I think that the main points I want to get across are a few things. What I would like to do is start on the left here and talk about way back in December, which seems like a lifetime ago, before we even had any COVID vaccines, what was going on. And so really, I think you probably saw in the news, there was a lot of press about the research and the studies going into making sure the COVID vaccines that were being developed were safe and that they worked. So the end result was that in December, the FDA did authorize 2 COVID vaccines to become available for use. And right after that happened, VA got its own allocation, or pretty much supply of vaccine, to start giving to our veterans as well as our staff. So if you can see on the left here, vaccine allocation, we've received more than 6 million doses of vaccine. So that's a lot of vaccine, and some of them are 2-dose vaccines. So that's the whole supply we got to administer both doses. And in the middle here, we have basically given pretty well over 5 million doses of these vaccines out to our veterans, our staff, many of whom are frontline healthcare providers or those who otherwise serve you with benefits or memorial benefits and such. We've also served our other federal partners who had mission critical location dependent staff, such as Department of Homeland Security staff. And we have also given vaccine to caregivers of our veterans. So I'm just extremely proud of how well we've done in VA to administer vaccine to so many of our veterans and our staff and our federal partners. We have also recently been able to give COVID vaccines to spouses of veterans, other caregivers of veterans, as well as some other individuals who are covered by the CHAMP VA healthcare benefits. So we've done even more than what's on the slide in terms of extending these vaccine benefits to others. in terms of what's been done to make sure that the vaccine continues to be safe for our veterans. We do monitor vaccine safely very closely, as you see on the right. Currently, there is a very low dose of any adverse events. So that could be anything from a sore arm to feeling kind of tired, or maybe even getting a fever. We closely monitor all those reports that come in, and the good news is we have not seen any significant safety signals arise that would make us worried. You may have heard in the past couple of weeks about the Johnson & Johnson vaccine being paused by the FDA and CDC to allow for some time to explore some very rare adverse events, stroke-like events in some younger women. The good news, it was found that those events are extremely rare. And so for the vast majority, millions of people, the vaccine is safe and there was no real cause for concern. So that Johnson & Johnson vaccine has come back and is now available and is being given to those who would like to get it. Next slide. So I just wanted to share with you what we did to help our veterans and staff get vaccinated, because as you may remember last year, there were a lot of worries about whether these vaccines were safe, whether the vaccine development was rushed. A lot of people weren't sure if this was the right thing for them. So what we did in VA is to really just let people know through as many channels as we could, as many times as we could, all that we knew about these vaccines. So that included our staff, so that they felt comfortable with making a decision to be vaccinated. And in turn, if they felt comfortable with the vaccine, we knew that they would tell their patients, their veterans. And so we used a lot of ways to communicate throughout the fall about all that we knew about these vaccines, so people had that information in their hands to make a decision. We put in their hands, as well as our veterans' hands, also some resources, because we heard from veterans and staff, they wanted to know the details. They wanted to know what was done to make these vaccines. How safe are they? Do they really work? What do they work to protect you against? And so we made handouts, we did social media, we put content up on websites so people could read on their own, because we know that the way that people feel more comfortable is by talking to people that they trust, such as their doctors, but also reading more. And so we put all that information in people's hands so that they had it in front of them. And what we did to prepare our health system to be able to administer these vaccines, which are different and actually more challenging to administer than pretty much any kind of vaccine that's out there already, such as a flu vaccine or a tetanus vaccine, is to train our staff, especially in the health care system, hospitals and clinics, on what they needed to do to make sure they got it right. And so we shared across our whole nationwide system who had it down in terms of giving the vaccine safely, given all the precautions we had to take because of the pandemic, who had the right storage equipment and how best to store it. So we just did a lot of sharing across the nation to make sure that we all had each other's best practices in hand that we could then use in places that needed them, to make sure that we all had the vaccine stored safely and could administer it safely to our veterans. So that was a tremendous effort to make sure that we got this truly life-saving vaccine into the arms of those who we serve, so that they could be protected. Next slide. So this slide is just meant to show you, not really to read this tiny print, but this is a snapshot of what we call our COVID, and it should be COVID vaccine surveillance dashboard. And the point here is to tell you that we in Veterans Health Administration look at how we're doing with vaccination very closely. This dashboard shows key information about how we're doing with vaccination, showing us by age, by rural status, by sex, by race and ethnicity, how we're doing with each dose of vaccine we've given. And the reason we keep a close eye on this, and our national leadership looks at this every single day and gathers all its main leaders throughout our health system together every day to review this, is that we want to make sure we're doing the right thing by our veterans. So for example, if we see that we haven't given many doses of vaccine to our rural veterans, we know we got to work on that and get the vaccine out closer to where people can get it. So I just wanted to assure you that we're looking very closely at how we're doing, and if there's any areas that need more attention, we go ahead and pay attention and go ahead and see what we need to do to make things right. So we're continuing to keep an eye on this very closely. How well we do to serve all our veterans matters. Next slide. So the good news is once you get vaccinated, we have some more freedom. And I think that is a terrific thing. I have to admit that I myself aren't used to the freedom after a year of wearing masks. I still feel like I should have my mask on everywhere I go outside my home. But I just wanted to highlight some things that we now can do once you've gotten fully vaccinated, which means that after either 2 doses of the vaccine, you wait 2 weeks, you're fully vaccinated, or after the single dose of Johnson & Johnson vaccine, wait 2 weeks and you're fully vaccinated. Once you're fully vaccinated, what can you do? So here I did want to hit some high points. I think some principles here, because there's a lot on this slide, is that you can get together indoors in small groups without a mask, but you just have to be mindful if there's someone who's, say, very elderly and frail or has lung disease, you might just still want to put on a mask around them indoors to make sure that if you have COVID or don't know it, that you don't pass it on to them. The really great news is that outdoors, as long as you're able to keep, a couple arms distance from people, we don't need a mask anymore. So especially if you're walking or jogging or, even watching your kid's soccer game and on the sidelines and you're not crowded, no masks. And I have to admit that is hard for me, but I have done it and it feels great, especially with the summer coming on. I know we're all glad to get rid of the masks outdoors. Although if it's crowded, like at a concert, probably you still want to wear a mask there just because, you can't keep a distance and you never know. The other good news is that if you travel in the United States, you haven't needed to, but especially if you're vaccinated, don't need to get tested before or after. The thought is that you are pretty safe from either getting COVID or passing it on to others. So really not a need to get tested as long as you travel in the US. What we still need to do on the right here is to wear a mask, especially indoors in settings where there are a lot of people. It's kind of semi-public, like a crowded restaurant or maybe in church where you're kind of tight together with a lot of people. That's just because I always think about other people and think, well, I'd hate to give COVID to them if I happen to have it and didn't know it. So for now, that's still the guidance, is to wear a mask, especially in the more crowded settings indoors. And so the larger indoor gatherings where we used to pack in, such as concerts, not quite there yet, but I wouldn't be surprised if that's on the horizon, the more and more people we get vaccinated. Next slide. So again, a few principles for us. Being outdoors where you can be a distance apart from people, no mask. If you're indoors with a smaller group of people, probably no need for a mask, but more crowded settings, you probably want to still put one on. But I'd say the good news is that we can take our masks off in a lot more settings than we used to, and summer is coming. So a lot of us spend more time outdoors, and boy, it feels good to not have that hot mask on our face, especially when it's hot and humid. So that is some great news, and I hope a great incentive to get vaccinated, so we can have our air going in and out of our mouth freely, and mouth and nose freely this summer. What a wonderful thing, just in time for summer. Next slide. So this slide is also busy, but I think I want to make just 2 main points here. Out of the 3 vaccines that are available, Janssen, Pfizer, and Moderna, they really all work incredibly well at protecting you against becoming severely ill or dying from COVID-19. They don't protect 100%. Now, nothing in life is 100% that I could think of, except for a couple things, but these vaccines do a pretty darn good job to make sure that almost everyone who gets them will not get severely ill in the hospital or die from COVID-19. So I kind of say I'd be okay with getting a mild case of COVID as long as I don't get incredibly ill, because I do not want to be in the hospital. So for me, the trade-off of getting a vaccine so I don't have to land up really sick from COVID is worth it. And of course, no one wants to die from this disease because it is pretty devastating. So these vaccines are very effective at giving us protection. They're also safe. I did mention the Janssen vaccine was studied a couple weeks ago to make sure these rare blood clots, which happened in some younger women, weren't a widespread phenomenon, and they were not. For most people, including younger women who feel comfortable with getting that vaccine, the CDC does say it's okay to get it. And the other two vaccines, there have not been similar safety signals or any other safety issues that would warrant any pause. So all of these vaccines are safe and have been very closely watched for any safety signals. And so I think you can rest assured that we will continue to keep a hawk eye on these vaccines to make sure if there's anything that would warrant people's attention and need to be studied closer, they will be. Next slide. So you might have heard of virus mutations and thought, what's going to happen with that? Or what is that? And so these variants or mutations in the COVID virus just mean that the virus is changing. And really, the viruses are kind of smart and they want to adapt to survive. And so whenever they change, they usually change because those changes make them easier to spread amongst people. And so the big question is, okay, so there are these new variants and they might spread more. Do our vaccines currently work against these variants, or will we need to get another vaccine? And so the good news is that the 3 vaccines we have in the United States look like they all do work against the variants that are the most common ones from other countries. They may not be as strongly effective in protecting us against getting severely ill from COVID-19, but they still do a really good job. So that is the great news about vaccines that we have, that if you get one, you will still have very good protection against the variants. Now, we are keeping a very close eye on variants because the whole nature of the game is that they like to change. And so we want to keep an eye out to make sure that when there's another change that happens that looks like it's spreading, that we want to make sure that we know where it is and if these vaccines will protect us. So stay tuned, but that is another area that's being very closely watched. Next slide. So again, I think I made these points already, is that the bad news is that you may have some decreased protection from these variants with these current vaccines, but the good news is that they still have protection, and the protection is pretty strong. It's not phenomenal as it is against the original COVID-19 virus, but it's really good. And so I just say to people, we're really in a race against the variants. The more people we can get vaccinated, the less these mutations will spread. And so the bottom line is, if you haven't gotten your vaccine yet and you're on the fence, if you do get one, you are one step towards helping us to beat these variants out in that race and help to protect us all. Next slide. So I did want to hit a few high points here for those of you who may want to keep in touch with VA to find out where you can get a vaccine or what's going on, with the vaccinations in your area or in the whole nation across VA. So the Keep Me Informed tool, which you can find just by going to va.gov, is a place where you as a veteran can sign up to receive letters via email about what's going on. And we have kept in touch with our veterans through this, throughout the pandemic, while we've had vaccine, to either say vaccine is coming or vaccine is here, or you can get it if you're older, et cetera. So it keeps you up to date. And we're continuing to send out emails to let people know where they can get vaccinated, and even to reach out to say, do you want to get on the schedule? Next slide. Again, they're on that va.gov website. This just tells you there's a lot of information to tell you more about if you want a vaccine from us in VA, where can you go? Or maybe you have questions, you want to know, what's up with that Janssen vaccine? You can find some answers on this page. So a wealth of information there. I encourage you to check it out if you do want to read more on your own. Next slide. And again, this is just meant to highlight all throughout the vaccine campaign. We have tried to make sure that our veterans get information on whether and when we will have vaccine through all possible ways we know that people get information, whether through social media, through tweets, through getting emails, through newspapers. We have heard that in some places people love their paper, like their actual physical paper. So we've used all of those channels to try to get the information and the word out to our veterans. and we will continue to do that. Next slide. And something I'm extremely proud of is our campaign to target our minority veterans who we would really love to get vaccinated, because I'm sure we all know that those who are of minority race and ethnicity have been especially hard hit by having many people in the hospital and even dying from COVID-19. And at the same time, there are also a lot of uncertainty about getting vaccines, especially in the Black community with the Tuskegee experiment, and even in other communities with mistrust of government. And so we've really made an effort to help minorities feel more comfortable with these vaccines, to know that these aren't just vaccines that were tested on white people. A lot of minorities were also tested, and it was found to be safe and effective in Blacks and Hispanics, for example. And just to be able to say, we understand where you're coming from, but we hope you can trust us, because we want you to be safe. We want you to not get sick from COVID, and we want your family to also be safe. And so a lot of work has gone into this, and I'm incredibly proud that we have not seen less people from minority races of our veterans be vaccinated compared to whites. They are right alongside, which means that we are doing great, in my opinion, with getting the word out and really encouraging our minority veterans to get vaccinated. Next slide. And I think that may be it, actually. So maybe I'll turn it back to Meredith. Thank you so much.
Wonderful. Dr. Kim, if you'll stay with me, I will go ahead and start with some of our questions that we've had. One of the questions, and I'm hopeful you can add some light to this, is how can people be comfortable with the safety of the vaccine, given its status as emergency use authorization rather than approved, which is, I guess, what we might expect. Can you explain that a little bit?
Yeah, that is a terrific question. And I will say emergency use authorization does sound scary. You kind of feel like, what's that about? So I did a lot of reading on that, because it was actually a new thing for me too. Even as a doctor, I didn't know what that was. And what it is in the law, it gives permission for the FDA to grant a quick approval, which means kind of an okay to use a vaccine or another product that could be potentially life-saving during really truly emergency situations, such as a global pandemic. So the emergency use is not necessarily kind of a scary thing for the actual product. It's just that the full process to kind of fully approve, say, a vaccine usually takes years. And during a pandemic, you do not have years, because every single day people are getting sick and dying. I think the worry that people had was that, boy, well, if they rush the approval, it must not be as good or as safe. And I do have to say that the reason that the process was so fast was that usually companies have to wait for each step to make sure that the vaccine works before they move on to the next one, because you just have to invest a lot financially in each step. But what happened is the US government funded all the steps to happen at the same time. So money was not an issue with the development. So things could go much faster than they usually do, because the funding was there already. And I will say that the other main difference is that the safety track record for these vaccines, there was a very high bar for that. But the other side, after the vaccines were authorized, is that there was very strict standards for continued safety monitoring, because that's the part that we just didn't have a huge amount of time to study. So that's why we're keeping such a close eye on safety, is because under emergency use authorization, that is a very strict requirement, because these vaccines were authorized and the safety part didn't have a really long time to go through. So, but we've had almost 6 months now with these vaccines, and they have all shown to be safe.
Excellent, thank you. We've had a couple of questions regarding boosters. And so I'll do the first question in 2 parts and then a follow-up. The question really is, will I need a booster? So one person gave some background. I have had 2 Moderna vaccines. The second was on March 20th. Will I need a booster? And if so, when?
Yeah, so I think we are all waiting to see if we will need a booster if we've gotten vaccinated. And there's just a lot of discussion about that. The current science tells us that the vaccines that are currently available, the length of protection we'll have after our second dose is probably at least 6 months, if not longer. And so, boy, I'm almost at 6 months after my second shot, but I'm hoping for 8 to 10 months. But the science tells us, yeah, I know. I was like, oh, should I go on vacation? But the science tells us at least 6 months, and that's verified through scientific studies. So I think we are all kind of waiting to see how much longer the immunity lasts. That's one factor in potentially needing a booster, is because when the immunity gets weaker, that might be time to think about a booster. The other thing to consider is the variants. So if there are different strains of COVID-19 and our vaccines don't work as well against them, will another shot help boost our immunity? So those are two main factors that will help scientists tell us whether a booster is needed and when. So stay tuned, I bet we'll hear more in the fall. Yeah.
And I assume that this is sort of the follow-up to that question. We assume that the VA will be providing information out regarding boosters and the availability of boosters when that time comes, correct?
Yeah, I'm sure we will. As I mentioned, the Keep Me Informed tool is probably a list of people, of our veterans, that we'll reach out to once we learn more. If there is a booster, I'm sure people want to know about it. And we'll also make, the booster availability and who should get it available through all other channels that we can think of as well.
Great, thank you. A lot of questions about flying on a commercial airliner with or without a vaccine, with or without masks. Just kind of your thoughts on those situations, given, the mission of the Honor Flight Network.
Yeah. First of all, vaccines are the best protection. You can have a mask and wash your hands, but vaccines are incredible protection to keep you safe. So I'd say that first and foremost, they are multitudes of times stronger protection for you than anything else you can do. But that being said, once you get vaccinated, I think you should still wear a mask on a flight. You're in close quarters, unless you're in some luxury flight. Most of us have to sit kind of close to one another. So, I just think about other people and think, well, even if I'm safe, I want to make sure they're safe by not, if I cough on them because I have allergies, I don't want them to be fearful. So I think almost all commercial airlines are still requiring masks, because you're close enough that even during non-COVID times, it feels like you're too close to some people and they're breathing on you. So even more so now with COVID circulating, we are still wearing masks during flights. Now, one day in the future, I bet that will change, but for now, that is the safe thing to do.
Excellent, thank you. I have two more and then we can wrap up because I know we're on a short time frame tonight. Any chance they will mix the booster with the flu shot for the fall? So you can do a one and done, I think. It's a good question.
Yeah. I've been wondering that too, but probably not, just because I know the flu vaccines are already decided upon, and I think they're being made. Maybe not made at this minute, but they're working on getting those off the, the conveyor belt, so to speak. The COVID boosters are still being decided on what's going to go in them and things like that. My dream is in the future, gosh, if COVID's still around in years, that we could have a combination shot, but usually comes after years of knowing what's coming and then deciding that you can do a 2-in-1. So I bet if there is a booster, we'll have to get the booster and then the flu vaccine. But hey, I'm going to do it.
We're all for making this as simple as possible, I think, right? And then last question, we'll let you go, Dr. Kim. The question is, if you have had COVID before you could get vaccinated, are you covered?
You have immunity, which means your body has immune response that it can use against COVID. If you've gotten it, it has protection. But that protection does get weaker over time, and that protection does get weaker at about 3 months or more after having COVID, and you might get it again. It's rare, but it's possible. So the CDC says, even if you've had COVID, unless it's been like in the past couple of weeks, you can get the COVID vaccine because it actually gives you a much stronger, longer lasting immune response that will protect you for longer. And so just because you had COVID doesn't mean you have a free pass. Just because you had COVID doesn't mean you can't get the vaccine. In fact, I would encourage it because if I had a patient, I'd want them to have the best protection possible, and that's through the vaccine.
Excellent. Thank you, Dr. Kim. We appreciate everything this evening. We appreciate the VA allowing you to do this for us, and we're very thankful for your time this evening.
Oh, thank you so much for having me. It is truly wonderful to be with you and just to be a part of your mission. Just a tremendous honor. So thank you.
Thank you. Bye.